An ST segment elevation myocardial infarction, STEMI, occurs when an artery that supplies blood flow to the heart is completely blocked. It requires immediate intervention to open the artery and restore blood flow to the heart. A non-ST segment elevation myocardial infarction, NSTEMI, is usually a partial or temporary blockage. While it is a less severe type of heart attack, it still requires urgent medical attention. If someone comes in with a classic presentation of a STEMI, you would not wait for blood work to come back, because the diagnosis is apparent anyway, Haythe says. Another disadvantage to saliva troponin tests is that they only produce negative or positive results, while blood tests can show the exact troponin level. Troponin levels risk stratify patients, Haythe says, adding that higher troponin levels mean a greater risk of complications. Additionally, troponin is not always an indicator of a heart attack. You can have chest pain for days and not necessarily have a positive troponin, Haythe says, but people can also have low troponin levels and renal failure and chronic heart failure. An initial false positive on a troponin test is not necessarily significant because a patient will have their troponin levels checked every 6 hours at the hospital. Troponin results are interpreted alongside other factors, including EKG findings, levels of other cardiac markers in the blood, and the patient's medical history. While the first results of the research are promising, Westreek says that there are still a lot of unknowns. Further research is needed to determine how long troponin stays in the saliva after a heart attack, he says. In addition, we need to know how many patients would erroneously be diagnosed with a heart attack and how many cases would be missed. It really will come down to whether they can show that people who are having cardiac injury are having troponin measured in the saliva in a reliable way, Haythe says. This test really needs to be validated and studied extensively before anybody will use it.